Hi, it's nice to see everybody here today. So, medicine has been very conventional recently, and it has always been very mundane. So that is why I'll be talking about something which I think is very close to my heart in terms of our medical practice. So, my topic, conventional medicine in unconventional hands, a change in the perspectives of the doctor-to-patient approach. So what is conventional practice? Have you ever been to maybe a clinic and then you ever noticed that when you left the clinic you felt, why am I feeling like my problems was not settled? I feel like, no, the doctor didn't do anything for me. You were probably poorly handled, or probably the doctor was not even interested in you. This is what I mean by conventional practice. Another very famous conventional practice is the doctor's reflex. I love this because this is what medical students will be doing all the time, because we will be automated response to treatment of symptoms. We don't look for etiologies anymore. If this is what doctors are doing nowadays, we will notice that our practice is totally conventional. We need to look further. We need to be unconventional. Okay, so we need to think a bit like a professional. We cannot be conventional as in medicine. So we need to think outside of the box while being in the box. So what is the box? So the box is basically myself. I am the embodiment of the box. My clinic is part of the embodiment of the box. My job, my responsibilities, my treatments, this is what it constitutes me as a doctor. But what is beyond my box? So, we spoke about looking for etiologies, all right? As we said here, I do things which is like free HIV test events, charity. We bring value to our patients and also solve problems. Very importantly, learn new skills also. So currently, I'm learning Mandarin, although I'm Chinese. But anyway, so why am I talking about the box and outside of the box? It is because I find that if I were just to stay in my box, in my comfort zone, I'll get bored with it. I want things to be more fulfilling, more exciting, and things that makes life exciting is your unconventional practice. To solve problems, bring value, learn a new skill, and not become bored and lose passion. And you will end up, if you are bored and you lose passion, you end up like a very common, conventional doctor. So, I always love entrepreneurs because I find that entrepreneurs are always trying to solve problems. Doctors, we solve problems, right? Medical problems. So, how should a doctor think and solve problems? You should start thinking like a problem solver. So, for me, I actually have a patient who actually came to me on one day, and usually when they come to me, it's usually problems below my the belt, okay? Something very private, okay? So, we did a few tests. It was positive for something. And my practice is, I don't tell the patient to come back after 1 week or after 1 month. I immediately will tell my staff, you call them and ask them to come, or I will call myself. So this is another very unconventional practice. In my clinic, that's what I do. So, this is my conversation with him. So, I said, hey Jack, how are you doing? And he's like, I'm still doing quite alright. Not in my prime, but quite alright. Are my results out? So, I said, yes, but more importantly, what is that bit that you mentioned just now? Not in your prime. So, I want you to focus on this. You have words like, quite alright, not in my prime, and the famous but. That means you know that there are small hints in a conversation with your patients, you know there's a problem. And when you come across a problem, please solve them. Don't just brush it off under the carpet. All right? So, we continue our conversation. So I say, I am feeling rather uncomfortable, but I'm okay. Do you think he's okay when he says, but? No. So, I gave him a solution, because now I know what the problem is. So I said, are your symptoms getting worse? I can make it better. Can you come over for a consult or over for treatment? And my patient said, I'm busy until next month, but I can try to come. With so many buts, do you think he will ever come? It will take him about a month. So, yeah, he's saying buts everywhere. So these are small hints that there is a problem. So, I will give you a few options to the audience, and I want you to think about it in terms of an unconventional way of approaching medicine. So, option 1, do you insist on him coming to the clinic? Option 2, do you ask him to go to the closest clinic to seek for treatment? Which is rather peculiar if you are talking about something private. I don't think he wants to go to anyone else. So, what is the third option? Do you find another alternative to get the medications to him? So, if you are thinking along the lines, yeah, insist of him coming, what's the problem? I'm the doctor. Patient needs to come and see me anyway. So, if you're thinking like that, please, you are going to be very conventional. If you're thinking of the second option, do you ask him to go to the closest clinic to him to seek treatment? You are actually almost there. You're actually halfway unconventional. Because I find that what is so similar about option 1 and 2 is this. The patient has to be proactive for himself. So this is what we call as conventional treatment. You know, conventional practice. People have to be proactive for you, not you for them. And now we go to the third option. Do you find another alternative to get the medications to him? This, I would say, very unconventional. So what I did was, I took the medication, I packed it, I told my staff, please send it to his house. And he got it in like the next day because it was post laju. And it's a very fast post. And he loved the entire concept. Well, it's like, I don't really need to come to you, but you settle my problems. So this is being unconventional. And what is so different between the first, the second option, and the third option is basically you, as a person, as a doctor, you are proactive for your patients. I find that if you have any medical students here, please be proactive. Don't expect people to be proactive for you. So I did talk to you just now about the box, all right, about finding fulfillment, to find excitement. So in what I did actually, the patient actually called me back the next week. He actually said, Doctor, thank you so much for, treating me and sending the medication. It was like so embarrassing for me to go to another clinic and tell them what I told you. So that gave me that sense of, wow, so satisfying. It's like, wow, so fulfilling. So that is what I say. Things outside of the box solve problems. Okay? Bring value. This is very valuable for your patients, an experience for them. And this makes my life, my job, very fulfilling for me. So what are my thoughts about medicine? We need to start thinking very unconventionally in our approach. And we need to always look for signs or hints of problems to solve. So, one more way that how I really approach medicine is in a very unconventional method is I use this one beautiful acronym. WOW! Very easy to remember. Just remember, wow, my work is so wow. Alright? So, first thing. The first W is warming up. Second, offer value. The third, the WH questions. So, what do I mean by warming up? So when we warm up to a patient, they tell you everything, okay? And it helps with your diagnosis and to find out what is their problem. So when we talk about warming up, it's basically when the patient comes to you, you do not address why are they here. We start talking about things like, how's the weather? How was the traffic jam coming into my clinic? know, warm them up to you. You know, this is like foreplay in some ways. All right? All right? So, warm up, and you will come off as a doctor who actually has your patient's interest at heart. So my father is a very wise person. He's 83, by the way. So he always used to tell me this thing. John, if you ever want to become a doctor, please win over your patients first, then only win over the disease. Which I agree. It makes perfect sense now that I'm practicing medicine. Because when I'm talking about private matters with my patients, they are not going to tell me when was the last time they had sex, how they had sex, until you really know me. So, warm up. Show them that you care. So, the next part is offer value. I will find that value is very subjective from one person to another. The perception of value can be, for each person, very different. So, some people say, oh, my monetary value is very good. That's what I think value is monetary, is money, you know, wealth. Some people will say, no, I find that skydiving was a great experience. It gave me so much of value and I enjoyed it. But what do we have which is of the utmost value? It is something that's exhaustible. You will never get it back. And that is what I call the time. When you offer value to your patients, you will know your time that you put aside for your patients, you will never get it back. You can use time to get money, gain wealth. You can even use time to gain experience, go skydiving or something. But can you ever use time to buy back time? Of course, it's your most precious commodity. And this is the thing that your patients need from you, which is your time. If you are able to give them your time, your value is exponential. Third part, WH questions, which is the normal, the who, what, etc., etc. Okay? So, what is so important about the WH questions? Because it's very challenging to ask questions. So, what do we mean about it's challenging about asking questions? Because it is the method to phrase our questions and lead people to their answer, or the desired answer, or a response. So, under the WH questions, I usually have another one more, or acronym. It's a very beautiful acronym, which I call it OWN. It's a O, not with a W, but a U and an N. Alright? So, it's called Open-Ended, Unjudgmental, Normalizing Question or Statement. If you are able to totally master this art of OWN, you will own the world. You'll be successful. So what do I mean by the first O? Open-ended questions. We highlight the problem. Then a question is directed to the associated problem. So this is how I usually talk to my patients. So I recently had a patient who actually came back from Jeju Island and she was quarantined for 14 days. And she was like, oh my God, it was like the worst experience. But, you know, you do not want to evoke any bad memories for her. So how do I still want to ask her how is she doing? So this is how I phrased it. I put the problem followed by the question. So the coronavirus is very rampant all over the world. My question, how has your ordeal been during your time in quarantine? You see, you set the mood. Like what I say, you need to foreplay. Right? You set the mood and then you ask the question. This concept is very effective in any circumstances in asking any indirect questions, you know, and you lead people to the response because you put a problem, and it's natural for us to like respond to a problem. With this, you are able to make sure that your patients are comfortable with any sort of questions that you have. So let's do a simple exercise, okay? So how would you ask your patients, you know, what is the efficacy of Viagra for them? Will you go like, how is your erectile dysfunction while on Viagra? If anybody were to say that to me, I would definitely have like, slap them. Alright? How would a proper sentence be? Remember, problem, solution. Tell me about any new sex partners you've had since your last visit. So nice. Question. What has your experience been with the use of Viagra? See, it's so nice to warm up. Alright? Now, this thing I think is quite good to have. So I'll do one more exercise. Now, you have another patient with fungal infection at the privates. How are you going to ask? So are you going to say, bluntly, so your thighs were itching due to a fungal infection between your legs, right? How has it improved after treatment? Come on. I would probably get my head cut off, man. Alright, so that is why. How you want to phrase a proper sentence. Put a problem before the question. So, the weather has been very hot these days. So you know when it's hot, you get itching, you know. So you go for the question. We attack the question head on. Do you get any itching at your thighs when you are sweaty after treatment? You see? That's a very sly question. Alright? So we come to the next part, which we talk about unjudgmental. Unjudgmental means be inclusive in your conversation or your questions without any biasness. So, I basically manage a STD clinic. I see people from all walks of life. I see the straights, the gays, the LGBT, the transsexuals, you know. So, sometimes we need to know how to be unjudgmental. So, I'm going to give you a scenario, and I hope we have a good laugh about it. So I actually have this one Chinese lady, beautiful woman. Her name was Chan YY, okay? But it's not really her actual real name, okay? So, when I opened the door, I was like, wow, she's so pretty. So I naturally called her Miss Chan YY. Then she stood up, smiled, and came into my room. And after we did the WOW, which is the wow, okay, which is the warming up, you offer value, you know, then you come to the WH questions. So I came to the problem. So I asked her, so what is your problem that you know you need to come and see me? And this was what she told me. I have pus oozing out from my penis. What? Wait. Did you just say pus oozing out from the penis? I mean, it's technically I asked myself this question in my heart. Of course, I didn't say that. So I was like, okay, hold on a while. Quickly on my computer, I was like, and I saw this, Tan YY, male. Okay, so really caught me off guard anyway. So I need to save myself. So I put on a very straight, you know, poker face, and this was what I said. Don't worry, okay? Many people have this problem. How long have you had this discharge? So, Chan YY, do you like me addressing you as Miss or Mr. or another more familiar name? See, this question is very unjudgmental because I allow her to choose what she wants. Also, this is a good save, very good save, alright? Save me a lot of embarrassment, okay? So this is what I mean by something unjudgmental, alright? A question that's unjudgmental. Now, she actually did comment. He said she felt very awkward also because this was one time that actually she got a response that was like, huh? Not the normal huh? And like, oh really? Yeah. No, she did not have something like that. So she was like, I'm okay with you calling me Miss, but that was a great save, by the way. So I was like, what do you mean by a great save? Because at that time I was like still thinking about the problem, so I never focused that what was so good to save. Alright? So she actually said, well, it is a great save because many people do not know how to react after they know that I'm a transgender, and you just allowed me to casually exert my preference about how I would like to be addressed. Okay? So this is unjudgmental. So we come to the next part, my last part, normalizing conversation. It is actually an idea, okay? It's an idea to generally affirm people or to tell the person that he or she is not the odd one out, not the weird one, not the weirdo. All right? So this is what we call as the herding mentality. So the herding mentality means monkey see and monkey does. All right? So we see what people are doing and we feel very comfortable because everybody is doing, so I should do the same thing. So how I make my patients feel very normalized, very cool, like, oh, don't worry, is because I will say this. I will always like to tell my patients that there are other people having the same problem, okay? And other people are also doing this thing, and this affirms them to feel very secure because they know how other people would react and how they would do. So how does this actually translate into the herding mentality? So there was actually a social study. So I'm just going to describe it as simple as I can. So there is a clinic that they actually had an actor in the clinic prior to anyone. So every time when the bell was rung, the actor would just like stand up, then sit down. Like ridiculous, or what people say, redonkulous. But anyway, there were new people who went into the clinic, and then the person pressed the bell, and the actor stood up, and the other people were like, what is he doing? So weird. Then they started asking, why are you doing this? Then he was like, oh, you didn't know? This clinic actually has a very nice rule. When we hear the bell, we stand up. It's a good exercise. And everybody's like, oh, okay. And everybody started doing that. At the end of that social study, almost 100% of them all stood up when the bell was rung. And they tried to get rid of the actor and all the other people. But this reflex kept on happening. Even when the actor left, they pressed the bell, everybody stood up like idiots. It was like interesting. So this is what we call by herding mentality. We like to be associated with people doing the same thing as our peers. So the herding mentality, you need to understand something about that herding mentality because it does not apply in every situation. Because if you have no facts, your claims and whatever you say is going to be dubious, and not everybody is that dumb. All right? So that is why I'm going to give you a very classical example before I finish off, which is herd. When we talk about herds, we are talking about pack of sheep. Okay? So this is my patient. He's the sheep. All right? And that's me, not the sheep. Okay. So this is a very classical example that my patients will always tell me, doctor, I don't want to take my medication. My friends and everyone says that it's bad for my kidney and my liver. See, he's trying to use the herding mentality on me by saying everybody. But like what I said, no facts, it will seem dubious. Well, I'm not that dumb because I'm not the sheep. Alright, so what I said, I see, in every action, there's a reaction. So you love eating, right? And the sheep went like, oh, yes. All right. So, I said, it seems like you have very high cholesterol and you're overweight. You should stop eating. Same thing, right? So, the sheep said, are you crazy? I will die. I was like, well, you said your medications is bad for your liver and your kidney. So, now eating is bad for you because your cholesterol and you're overweight. So you should stop eating. See, I'm using that the same analogy with the patient, okay? So the person said, you can't be serious. I was like, come on. Well, it is just, I was using the same analogy as you did. However, it does not mean that it doesn't change the fact that many people are also on the same medication, and some of them are on lifetime of medication, and they are not necessarily facing with liver and kidney problems. All you need to do is monitor your liver and your kidney function while you are on those medications. And same goes to your food intake. You need to monitor your weight, your cholesterol, and probably your sugar, and know when to take action. So you see, I was actually using like, the herding effect, but with facts. Because many people are also on the same medication and no problems. So we are backing it up with facts. So it's not dubious. Even the sheep is not that dumb to listen, will be smart enough to trust me. Alright? So if you are able to master this art of the WOW, like wow, and you can own, you can even use this concept to trick an eagle to think that it is a chicken. Alright? So as a recap, very simple. Look beyond the box and find fulfillment. Do not be stuck with a boring thing day in and day out. Be a problem solver. Be proactive always to your patients and not hope for other people to be proactive to you. And remember your wow, your own, because if you are able to wow and own, you master this, you will be able to own the world. That means own with a U, not a W. With that, thank you.